Health officials in Chautauqua County have voiced their concerns about communication with the state over vaccinations. They feel the county is being left out of the loop while 2 state-run sites open up in Buffalo, one of those at UB South. This morning, the 7 Eyewitness News I-Team has been trying to figure out how many doses are available at that site and when you might be able to get a shot. And all new for you, we are getting some answers, but the state is still leaving us with many more questions. The 7 Eyewitness News I-Team has learned the state-run vaccination site at UB South is now fully booked through April 16th. But for many weeks, the state's Am I Eligible website has said no appointments available. So when did these appointments that are suddenly booked open up? When was the last time a vaccine appointment was available at UB South? And how many doses of the vaccine does UB South have right now? All a mystery because the State Department of Health has not answered these questions for us.
More people really expected to be able to access it than have been able to.
Christine Schuyler is the Director of Health and Human Services in Chautauqua County. Even she is still waiting for information about how many doses are even available outside the Health Department allotment. She's requested information from the state about who is providing the vaccine in Chautauqua County, weekly allotments, and other data, but still no answer. How much of a detriment is it to this effort to vaccinate people if you don't have access to that information?
I feel that local health departments are the Switzerland of public health for our counties. And we are relied upon and looked upon as that source of information. And we know our communities. We know where our more vulnerable communities are. We know what efforts need to be put into place. We've been doing this for years.
Schuyler says many people she serves are calling, frustrated they can't get an appointment for a vaccine. She says their expectation and belief is the county is in control and has more information about the vaccine than they actually do.
We know how much we ask the state for. We know how much we get allocated, but we are not privy to how much vaccine is going to hospitals, pharmacies, or federally qualified health centers at this time really are the other main vaccine providers, unless we talk amongst ourselves and locally we are able to get that information.
Outside of crowdsourcing, you're unable to point somebody in a direction to say, hey, go to this provider or go to that healthcare center or go to this website to try and get the shot because you have no idea who is even signed up to be a provider at this point.
Yeah, correct. We are the ones who really should have all the information so that we can best serve the residents of our county. That's what we're charged with doing.
The state reports 11.2% of the population in Chautauqua County has received at least one dose of the vaccine, compared to 13.4% of the population in Erie County and 9.7% in Cattaraugus County. But Schuyler is still looking for a more coordinated response between the state and the counties.
The bureaucracy in New York is such that the governor's chambers really seems to be guiding and controlling the pandemic response, including the vaccine rollout. And that's all well and good. They have the ability to do that. But at the same time, I'm really disappointed that there hasn't been a better partnership and a better respect for an alliance with the public health officials, both at the state level as well as local health departments.
Schuyler says she is hopeful the tide is turning and the state realizes there needs to be a partnership to make sure there is fair and equitable distribution of this vaccine. Meantime, we'll keep watching those UB appointments and update you when we get answers from the state. And we know with this county-run clinic at Fredonia, they're hopeful they can get more shots in arms. But again, only 800 vaccine doses available from the state this week. So again, a process that's a long haul rather than a sprint.